Hi, Dr. Hagmeyer here, and in today's video Success Secret, I want to talk to you about an email that I recently received. It was from a lady who was really asking me about gluten. And she said to me, she had a question that was something along the lines of, how much of a problem does gluten cause for people with thyroid problems? And so this video, I just want to touch upon that because I know that's a big problem. There's a lot of questions that are being, surrounding thyroid problems and gluten. And so if you don't know what gluten is really the protein that's really found in all grains. It's found in wheat, it's found in rye, it's found in barley, it's found in oats. And the big thing that's important to understand about gluten is really gluten is found in any grass-bearing seed. So if it comes from a grass, it contains gluten. Okay, that's how simple that is. This protein is what really gives the bread that a lot of people eat, the soft, chewy, elastic, doughy taste that we're familiar with. It also makes pizza so tasty. Okay, so if there's one piece of dietary advice that I could probably share with you, and really this is not knowing anything about your personal health history, this would be it. Avoid gluten. Plain and simple. Avoid it like it's the plague. In fact, doing this one simple thing, you may be able to reduce your thyroid hormone replacement by as much as 49%. In fact, in a study done last year from the Journal of Clinical Endocrinology and Metabolism, they looked at celiac patients, and they found that patients who have celiac disease that also have Hashimoto's thyroiditis require 49% more medication than patients who have Hashimoto's disease that don't have celiac disease. And so by removing gluten from your diet, that will reduce the burden that's being placed upon your immune system that's really causing and really ultimately have almost like a cooling effect on the immune system. So it's going to calm down the immune system's attack on the thyroid gland. It's also going to calm down the activity of the thyroid gland. There's also growing evidence that gluten may be one of the main dietary triggers of not only Hashimoto's thyroiditis, which is an autoimmune thyroid, but many other kinds of autoimmune conditions. So if you have an autoimmune thyroid or any other autoimmune disorder or disease, then eliminating gluten really here is really a no-brainer, okay? So now if you test positive for gluten, then I'm gonna highly recommend that you find out what other foods that you may be sensitive to that could also be triggering thyroid symptoms. Well, I hope you enjoyed today's video success tip. If you found it helpful, I'm gonna ask that you share it with someone. There's so many people out there that are just struggling with chronic health problems, and they are so frustrated, and they're just going from doctor to doctor to doctor, really not getting any answers. So my hope is that you share any of the information that you feel is helpful, that you pass it on. Thanks so much. Take care.